Good morning, this is Kasturi Day. Today again I have come to discuss the health and hygiene according to ICSE syllabus class 8. Okay, so I was discussing the first aid mechanism for different purposes. Now today I'll discuss the first aid for the stings of insects. I'll start with that. Okay, so certain insects like honeybee or wasp, they sting when disturbed. Okay, and this causes enormous pain and discomfort to whom this insect stings. Okay, now to provide the first aid, the steps are: we should keep the person calm and remove the sting with the help of the tweezers. First we should keep the person calm and then remove the sting with the help of a tweezer. Then with the help of an adult, we should scrape the area on the skin with a blunt knife. We should not cut, we should not put a cut, but we should scrape the area of the skin with a blunt knife. Now after that we should wash the area with soap and cold water, and then we should apply some oil or Vaseline and cover the area with a sterile gauze. Okay, now we can also apply some ice on the area which is swollen due to the sting. This will provide to the victim some comfort. Okay, then we have come to the first aid for the objects in the eye. If any object and if any particle which has fallen in the eye, or it has gone inside by any by accident, we need to get rid of it. Okay, and how can we do this? By we should not rub the eye. Okay, but lift the upper lid over the lower lid to enable the lower eyelash to brush the particle out. Okay, now move the eyebrow to move the particle out. Okay, so we should not rub it, we should not rub the eye, otherwise it can cause harm to our cornea or to the eye itself. Okay, so we should lift the upper lid and put it over the lower lid so that the lower eyelash can brush away the particle out of the eye. Or you can also move the eyebrow to move the particle out. Now we should blink a few times and let the eye move the particle out. Now, or we can also flush some clean water, or use an eye wash solution to clean the eye. And if still the particle remains, then we should keep the eye closed and we should seek the help of an ophthalmologist or an eye doctor. Okay. Next we have come to the first aid for bleeding. See, bleeding are of two types. It can be external or nose bleeding. Okay, so bleeding can be threatening, because if you go on bleeding, then it can cause some hemorrhage. The bleeding should be stopped immediately. First and foremost thing, we should stop the bleeding. Now, external bleeding, if it is an external bleeding, we should raise the bleeding part to reduce the downward flow of the blood. Any part of the body is cut and it's bleeding, we should raise that part of the body to stop the bleeding. Then apply the pressure on the bleeding part with a clean cloth or a pad of cotton so that the bleeding can be stopped. Now we should not wash the wound we should not wash the wound except if it is due to a dog bite, then only we should wash the bleeding. Then when the bleeding stops, apply some mild antiseptic lotion. After stopping the bleeding, we should apply some antiseptic lotion and then cover the area with a clean bandage. Okay, and use an antiseptic, and if possible we should use an antiseptic bandage. Okay, next we come to nose bleeding. Now if we have seen many persons who bleed from their nose, So in that case, we should keep that person sit upright and lean forward to reduce the blood pressure in the veins of the nose and the formation of a clot. Okay, so that their blood pressure in the nose reduces and there's no clot formation. Okay, so we should keep that person sit upright and lean forward. Then we should use a tissue paper or a soft cloth to soak the oozing blood which is coming out, the blood which is coming out. We should you give that person some tissue paper or soft cloth to soak that blood. Then we should place some ice cube or cold compress around the nose, and we should not, another thing is we should not consume any drug without prescription. Okay. Next is first aid for fractures. See, a fracture is a crack in the bone which requires immediate medical attention. Okay, so a fracture, it's a crack in the bone. Okay, so in that case, if this happens to a person, the victim should be kept in such a way that we loosen his clothes, his or her clothes from the affected area. Then if there is some bleeding, then we should apply some pressure to the wound with a clean cloth or a bandage so that the bleeding stops, and then we should make that person lie down comfortably. And then we should not mobilize that injured area. Okay, we should not move that injured area. We should not massage that place or stretch any affected part. Okay, then we should apply a splint to that area, a tough substance, a tough structure like a rod or a stick should be tied to that area, so that above and below the fracture area, so that the affected part does not move. Then we should apply some ice packs so that there is no swelling, so reduce the swelling and relieve the part from the pain. Then we should not apply ice directly, rather we should wrap the ice with a cloth, and then we should place on that affected area. Then try to keep that person calm, otherwise he will move his body. So when the person becomes calm and quiet, then only the affected part will not be moving and the person will be in static state. Okay, in more, he or she will feel more comfortable. Okay, that will reduce the pain, swelling, everything. Next we come to the first aid for unconscious. A person, when he becomes unconscious, what should we do? We should lay that person down comfortably, loosen his clothes, his or her clothes. Then we should open the doors and the windows of the room so that fresh air comes in, and we should not allow any crowd to gather near that person. Then we should gently sprinkle some water on the face of that person or the victim. Then if there is still unconsciousness, then we should remove any type of dentures if there is there, or false teeth if it is inside his mouth, his or her mouth. We should remove that structure or any other foreign objects which are present in the mouth, so that he does not swallow it, okay, by any chance. Then we should turn the victim's head to one side so that he can resume breathing normally. And then if still the unconsciousness continues, and he is breathing normally, then we should lay the person down and raise his lower part, that is his legs, his or her legs above the chest level, so that the blood flows from the lower level, that is from the leg, to the vital organs, and his consciousness comes back. Then Next is, if a person swallows poison, then what should we do? We should check for the symptoms of poisoning, such as if he is drowsy or unconscious, or he has a difficulty in breathing, is vomiting or not, is it redness around the mouth or lips, like that. Then we should remove the remaining poison from the person's mouth. Then get the person into fresh air. We should keep the person in the fresh air, and make the person drink a lot of water, that is especially salt water we should make that person drink, so that that induces vomiting condition, and he vomits out the poison which he or she has taken in. Okay, then we should collect that vomiting inside a bottle or in a package, and we should keep that to show the doctor, and immediately we should call for an ambulance or a doctor for medical help. Okay, so this is the end of this chapter. We'll continue with the question answer series in my next video. I'll start with that question answer series. So till then, go through this chapter. If you have any doubt, please do write in the comment box, and if you like the video, press the like button, and also share with your friends, so that they can also be benefited from these videos. And if you are a new viewer to my channel or not subscribed yet, please do subscribe to get the notification of my next video. Thank you.